Okay, well, thank you all for being here. And today, what I want to talk about is a scalable solution which uses artificial intelligence and embodied AI to help educate and train clinicians. This is the low-hanging fruit, I think, in healthcare, but it's also a very important step. A little bit about me. I've been in academics for 20 years, both at USC and UCLA. I have some friends still left, which is nice to know. And I've been in education this whole time, and I've seen the transition and the transformations that's happened. As a matter of fact, that's me in 1999 at the VA West LA hospital, my first job. Back then, life was much simpler. We had pagers, flip phones, and also library cards. People know what that is? Photocopy cards, and maybe some CD-ROM discs for some education. And fast forward to 2023, this is really the current state of healthcare in North America. It's essentially broken, and it's broken in a bad way, and people in healthcare are really lost. So not only the patients, but also the physicians as well. And they're seeking direction. There's lots of confusion, there's siloed experiences, and really no good knowledge, consistent knowledge base for people to work off of. And that's all amplified what I call cognitive load. Some people call it burnout, some people call it moral injury, but it's increased cognitive load, and not just for the patients, but also for the clinicians as well. And the factors that have really contributed to this include reduced patient contact time, explosion of information, and also explosion of misinformation, reduced trust between physicians and their clinician, reduced workforce, increased demand for profitability, vertical integration of care models, and also increased noise in this whole environment. So we're really at a horrible time as far as the pressures and demands, both on the patient side and also on the clinician side. This is Daniel Kahneman's book. He's a Nobel Prize winning economist, and he talks about noise. And noise is a flaw in human judgment, and specifically occasion noise. Occasion noise refers to a type of flaw in our judgment that's beyond our control, which means our judgment can be affected by our fatigue, anxiety, mood, time of day, time of week, and even the weather can affect our judgment. So there's research to support that if you go and see a physician on a Friday afternoon, you're more likely to get opioids prescribed for you as opposed to a Monday morning. Or if you're seen in the afternoon, you're less likely to get cancer screening prescribed to you than in the morning. And that is a fundamental flaw in our healthcare system that's become very noisy and very difficult to navigate. I don't know if people are familiar with DALL-E. This is an open AI image generation software. I put the prompt in, typical doctor visit, and this is what I got. You can tell it's AI generated because of the imperfections in the nose and the hand, but it's emblematic of our clinical interactions these days. There's a computer in the room, clinician staring into it, entering data, patient staring off into nowhere, and there's really no interaction between the two. And this is really a huge flaw in how we care for people. And it's really a problem when it comes to patient engagement and education. There are additional hurdles. Really, in med school, there is no formal education. As a matter of fact, when I was going through training, we found who was the most engaging, empathetic professor, and we really followed them, and we used them as our mentors. But today, it's Professor YouTube, and there isn't even enough time for feedback to our students. So we don't know how they're performing in front of patients, and we're not even able to give them feedback on that. In addition to that, we also overestimate our patients. As a matter of fact, 80% of the time, we think they understand what we're saying, but they don't. And this meme here is an example of that. You know, you're out of magnesium, and the patient, scared, isolated in the room, is just looking and saying, oh my God, what does that all mean? and please don't tell me any more news, I want to get out of here, right? So we have to not only educate our patients, but also have tools to train our clinicians in order to bring that humanity back into the office visit. Now, there have been digital front door solutions proposed, and they're supposed to be this magical experience where you pass a threshold and there's care coordination and all the information's there. But as a matter of fact, these digital front door tools have made the problem worse. People are in their EHR looking up stuff without any reference point to what that data means, and they don't have any good resources to go to. So they go the path of least resistance, which is Google, YouTube, and we all know how those algorithms work, right? They work on your fear factor, and they take patients down this rabbit hole, all wound up, and 3 weeks later, we see them in the office trying to unwind them. So we have essentially, as clinicians, have lost the narrative here. This study stood out to me. This is recently published in JAMA at 2 top academic institutions on a major city, major coastal city in the United States, with amazing reviews and awards. The results are really, really mind-boggling. And for people in the room, don't worry, it's not on the West Coast, it's on the East Coast. So our institutions here weren't studied here. It's an observational study that looked at the discharge process. And what they found is that more than half the patients didn't get information about their medication, and more than 50% did not get self-management guidance, and an astonishing 82% weren't even educated on the red flags. So imagine you go home discharged from the hospital and you're sitting there, you have no idea what to do. And this transfers into more cost, obviously, and worse outcomes. Another interesting thing to note on this study is that the attending spent 3 minutes with the patient in the room at the time of discharge. And the intern spent 4. So probably the intern stood in the room long enough for the attending to be down the hall and then left. And most of the heavy lifting was done by the nurse. And guess what the nurse's discharge is? It's a stack of papers like this, right? So they're handed this on the discharge, and they're told, sign here, and here's your appointment. And this is a conversation, actual conversation. Patients saying it's too much information. And it doesn't really have to do anything with me. It's not personalized. And reading it is so scary. It looks like I'm going to die. Well, the poor nurse who's overwhelmed has to get the patient out at a certain time. And there's those factors that drive this conversation. So it's really, really a broken system when it comes to patient engagement and communication. And this is an astonishing graph. We've all seen what's happened with our costs and inflation, but most expensive costs today in the United States, the most increase is in hospital services, college tuition, educational services, while technological services are coming down in cost. So the solution has to be through some sort of a technological advancement. Another sobering slide here. This is the drought chart for nursing across the United States. We're in trouble because there aren't even enough nurses that we can recruit to help train, educate, and move our patients to be empowered about their health care. So what are the solutions? How can we get ahead of this problem with the latest tools that we have in technology? And today what I'm going to talk to you about are 4 really important technological advancements. One is conversational AI, or generative large language models such as ChatGPT. The other one is embodied AI, which is really expression through movements, speech, facial expressions. Targeted videos. This is really important because we see all these videos and they're 45 minutes long, and we just want to get to that 2-minute section that we want, and we don't know how to get there. So giving patients the information that they need, and then really deploying this technology in all platforms, whether it's a mobile app, on your laptop, through VR, or through augmented reality as well. So do people recognize this sign? This is the OpenAI's logo, and ChatGPT, everyone's heard about Chat. It's an amazing tool. It is the sentinel platform shift in technology that we're going to be utilizing in the future. It's fantastic, but it's got problems. And the problems really have to do with the way the models are designed and how we control those models. So I'm going to dig a little bit more into this just to bring everybody up to speed. So how are these models made? Well, the first thing you need is large data sets. As a matter of fact, you need a lot of data. We're talking about 170 million data points just to get into the model. And then a human has to come in and clean that data. So already, before you get started, you're introducing a certain level of bias. Now, those aren't nefarious players. Those are good humans with good intentions. But we're all stuck to this internal bias that we can't get away from. Another drawback is that you have to freeze the data. So ChatGPT has data only up to 2021. And anything beyond that, it certainly doesn't know. And it has to be focused in a certain area. So does it know medical knowledge? Not necessarily. It just knows what it's been trained in. And that's the first step. And once you've created that, then you create a language model. And from there, humans intervene again. And they use a process called RLHF. I don't know if people have heard of this, but this is really reinforcement learning with human feedback. What that means is that there's a scoring system. The human sits there, looks at the return, and then gives it a certain value or certain preference to create alignment for the model. I call it bias, but the people in technology, they call it alignment. So that model is being aligned to your preference, and whether that's neutral, bias one way or another, we don't know. So we simply don't have control over this type of technology as end users. And as a matter of fact, there's some horrible stories from this, right? So this is a research group out of Paris that looked at ChatGPT-3's response to a fake patient trying to kill himself. And he said, should I kill myself? And the answer is, I think you should. Not enough guardrails, right? So we need to have limits on this, and the limits have to be internally created by the content creator. Here's another example. 2 different responses to the same question that was asked. And that has to do not only with the tone, the language that's utilized, but the specificity of the prompt asked. As a matter of fact, now there's a whole industry of prompt science generation, knowing what to ask to get a specific type of response. Well, that's not a really good scalable solution, because I may ask, how you doing? And someone may ask in a more angry voice how you're doing, and I'm going to get 2 different responses from the language model. Not only that, the responses are not unique to the content creator. So the responses are created based on the data science and the process that I showed you. So wouldn't it be great if we can take this technology and put it in your hand, where you're in control of the AI and not someone else? So models are fallible, and there's really no clear, defined endpoint to these models' creation. That means that we'll never finish saying, okay, you're good enough as a human, or you're good enough for this. They continually get aligned and improved over time, and that is also one of the challenges as well. So what we've been working so hard at High Technologies is to create a platform where we put the power of artificial intelligence in the content creator's hand. And we call that platform, a delivery platform, an IVO, and we call our tool physician-controlled AI. So now you're in charge of not only the narrative, but the guardrails that go around this. You can create limits on either side of this as what you want your audience to hear, and you won't give it parameters that will make it go rogue, which is really important. Because if a patient asks me, my pain's getting worse, my first response is, call me immediately. It's not take 2 Tylenol, call me tomorrow, or go to the ER. I want to talk to you because I want to know why you're getting worse. So we've created a platform where you can memorialize knowledge in AI. You can present your custom design information. You can ask questions from the audience, and you can also answer questions to your audience in your own words, and then measure comprehension, record tracking, and each session is unique. This tool can be in your hands today to create these sessions, which I will show you in a second. So this is what the platform looks like. We've leveraged embodied AI, arm movements, speech, facial expressions, voice. And just like I'm standing here at a conference, at a podium, speaking to you, there's a presenter, a character which we call CME, or continuous medical educator, and a presenter screen on the side. Now, the presenter screen can display any rich media that you like, including videos, web links, slides, and then you have standard control buttons on the bottom to control the session as well. And I'll go through a little bit of detail explaining that. What are the 4 things that the system can do? 1, it presents information, your information, not Google's, not anyone else's. It answers questions, your answers to your questions, and also can ask questions to assess comprehension and also to gather information, whether that's your phone number or an image or whatnot. And it records and measures all this on the analytics side, so you have more insight into how your audience is really interacting with this content. And we've gone one step beyond. So we have an on-screen digital assistant, and then we can also have a voice-only digital assistant. And then a hybrid model. So, as the digital assistant is talking, let's say it's presenting a video, then it can go to full screen, and then she fades away in the background, and then she or he can come back as the conversation continues. And all of this is at your control. In addition to that, you can pick your character, you can pick their voice, you can pick their dress, and you can really customize it to your audience. So the IVO is really the next step in engagement, not just in healthcare, but in healthcare and beyond. Your other tools are really little creepy boxes like Alexa and Siri, which, as you may or may not know, are kind of on their way out. Or binary text chatbots, do you want an appointment? You don't, fine. And then the traditional models that have not necessarily been successful. And this is what the platform looks like. This is called Haya Connect Pro. This is an authoring tool that we have. And it has 3 important steps: create, share, and track. And it's very intuitive. We can put it in front of even a high school student to create these sessions. And I'll go over each one of these components individually. So on the creation side, you have the ability to create 4 different types of modules. Presentation modules, where someone's just speaking. AI topics, this is your own AI. This is the physician-controlled AI that I alluded to earlier, with your questions, your answers, and any rich media that goes with it. Quiz, so you can ask a quiz, but also in that process, you have the ability to give the immediate feedback about the answer and use the teach-back method to not only assess comprehension, but immediately correct or reinforce the learning that's there. And then forms, which is the interactive way of getting information.
And how does
and the basic structure is something like this. Now, this is a way old character that I put up there. Our characters look better. This is actually in the old Unity engine, which makes the characters not look so great. But it's essentially this. You have the ability to import PowerPoint or Google Slides. Once you import that, you get a presenter screen with the media that you want on there already. And the words spoken by the character are already imported in the bottom tab there. And you can also control the pronunciation, pauses, really change the tone, and then add visual components such as gesturing, media, and on and on. So you have full control of these sessions and publish it immediately. So there's really no need to go to a third party and go, I want this. It's a tool in your hands. So let me give you a little bit demo. This, if you could adjust the volume if it's too loud. Sorry for, this is pre-recorded because of all the barriers to Wi-Fi and everything else. I just played it safe and recorded some of this. I'd be more than happy to show a live session after this as well. This is for my practice as a hand surgeon. It's a common thing I see, trigger fingers. And it's one of my trigger finger modules for my patients. So I'm going to go ahead and play.
Thank you for joining me today. I'm here to share information from Dr. Ghiassi's solo hand surgery practice. I am Dr. Ghiassi's SIMI, or Simulated Assistant Luna, and I am trained to talk with you about a condition known as trigger finger or trigger thumb. Dr. Ghiassi, would you like to say a few words?
Hi there, I'm Dr. Ghiassi, and that charming character over there is my digital assistant, Luna.
Luna has been educated by me to give you an in-depth presentation on your condition. She can also answer many of the questions you have on the topic, so make sure you ask her questions as well. Keep in mind, all the information she's giving you is based on my knowledge and experience, and not some random place on the internet or Dr. Google. So I hope you enjoy the experience. I want to thank you for your time, and have a great day.
Right, so that's an embedded video I did, and you can see, I mean, if I was going to do this whole session as a video thing, you know, we'd be in trouble, right? She does a much better job than me. But you saw the full screen presentation mode as well. The other thing that you saw is when she's talking about trigger finger, she's holding her finger up. And that has to do with her internal tools to animate the character based on the spoken words. So there's some animations that relate to that that can make the experience more engaging. And then there are custom animations that you can add on to it as well.
Thank you for joining.
So what does the user interface look like? I took the sound out of this one, and the reason is that I'm going to speak over her. But you can see there's a pause button and a play. So like any video, you can stop it and play. You have a skip slide button, which is to the right of that. So you can skip ahead. You can also skip chapters. So if you want to go to, for instance, the symptoms chapter, use the double fast forward button, and it allows you to go forward. And she skips ahead to symptoms. And then you can also go back a slide. So you have a back button. And in addition to that, you also have a table of contents navigation tool. So you can, you know, go to the exact section that you want, you know, follow-ups, treatments, on and on. And finally, you can send a message to the provider. So this acts not as a replacement, but as a filtering tool for the interaction. And you can send an email to whoever the stakeholder is, and yeah, everyone gets my email now, so that's wonderful. But you can communicate with your provider if the system is not doing the job that you wanted it to. So you're no longer in this space where you have the electronic health records telling you you have severe arthritis, and you're going to Google to find out what it is. You have the tool, you have the part of the doctor's brain that is so important for engagement and empowerment of your healthcare condition at the tip of your fingers. Now I'm going to show you the interactivity. This is the microphone button that you saw there, the red button. And there's 3 ways to engage with the system. One is speech to text. Another one is pre-populated questions. And another one is just typing in your own text. We'll start with the pre-populated questions. The reason we have the pre-populated questions is to really encourage people to ask questions and give them ideas. And we find this like, oh, I want to know about my, medical records, right?
All the medical records are available to you online. You can use our patient portal to register with Dr. Chrono Electronic Medical Records. If you have any questions, please ask Dr. Ghiassi. Here is the link.
So when she says here's a link, there's a live link there that will take you to the portal. So you're getting the information that you want for my practice immediately. And it's visually engaging. Let's see what chat OpenAI would say to that. How do I get my medical records? Well, here it is, right? There's a submission request form, which proof of identity, a fee, on and on. Not accurate, but very convincing, right? And not really pertaining to me. So I'm going to show you the text component of this where you can type in a question. You hit the microphone button a second time, and a text prompt comes up, and you can type in, correct, your question. And the question is, how does it present? So it's not even...
Looking that up.
Contextually...
There are variations in presentation, with some patients having mild symptoms of pain in the finger. Other patients have a locked tendon every time they bend the finger as shown in this video. The patient can unlock the digit, and this can be painful. No X-rays, MRI, or special tests are needed to make this diagnosis.
So right there, I gave a very nice visual presentation to the patient of what this looks like, and also gave them the information that they need to know before the visit. They don't need X-rays, they don't need MRIs. This is what you need, right? And then the final, let's see what chat tells you, right? So chat, the response is stiffness, that could be arthritis, popping, everyone pops, Pain or redness, that sounds like an infection. I've never seen a trigger finger that's red. Difficulty straightening your finger. I mean, on and on, right? And then the interesting thing is, it says numbness and tingling may be a sign and symptom. And I can tell you, if you got a trigger finger and your hand's numb, it's not a trigger finger. It's a nerve issue, and it's a secondary diagnosis that can potentially be worked up. So these language models don't have the guardrails that are specific to me, and they spew out information that's very convincing, but can also very dangerous. Here's the voice.
How do I change my bandages?
Looking that up. Here's a video on how to change your bandages if they get wet, dirty, or too tight. You simply unravel the top layer, and you will find the white cotton underneath. You can remove this as well, and you will see a small plaster splint.
So you can see a low-quality home video that I did there for my practice. You know, I don't have a studio. Obviously, you can put studio production material in there, and that's my wife's hand. But it brings that sense of this is my practice, and I have ownership to the audience as well. Now let's talk about comprehension or quizzes, right? So you can create your own quiz, assess comprehension, and give immediate feedback. Here's one of the examples for a quiz and the interaction.
Which of the following is not a symptom of trigger finger?
And I'm using the touchpad here, so you don't see a cursor.
A is correct. Numbness or tingling is usually a sign of nerve irritation and may be related to other issues. So if you have any numbness or tingling, please let your doctor know.
Right. So you can see not only did we tell them that it is not a sign, and I want my patients to be aware, if you're numb, tell me, but also reinforce the education as well. What I was trying to say earlier too is that since this is on mobile, you can activate it using touchscreen technology as well. So all sorts of ways of inputting, all sorts of ways of getting data out, and the ability to customize and edit to your heart's content. For sharing, the next step, you would have 3 minutes? Okay, so let's jump ahead and talk about analytics. The analytics really gives you the granular data that you need to understand your patient's needs. It talks about top-level data, such as the number of views, the unique sessions, but also the questions that they asked and they didn't have answers to, and the questions that you want to also know about that you didn't put in there. I'm just going to show this. I'll pay extra for the 2 minutes, don't worry. This can be, I will. This is implemented in VR. You can see our portal there, the Higher Topics portal, and then the activation of this. So let me speed this up a little bit. Sorry, it's going to come up in a second. But for more immersive experience, you can actually activate this in virtual reality as well. And the platform, that's on a web browser, obviously. Once it activates, you hit enter the site. And I'm going to ask you just to hold off till she enters the site there as well. So this is one of our older characters. And you see the blue button there on the right. It says enter VR. And you'll go ahead and enter the experience through that. And so there's a character fully animated, just like you had on the mobile platform. You can look at her, walk around the stage, look all around, and have a more immersive experience. The value of this in training is immense, especially for difficult conversations, especially when you're trying to get young minds to understand how to speak to patients. And the final, this is with spatial background there as well. This is a hospital waiting room, and the character is embedded in there. And the goal is to activate or to ask questions from an end user. And it's a 1-minute video, which means in about 40 seconds it will be finished. I just want people to see this one part of it. So imagine you're a young doctor in the ER, and you get this patient come in. And she's going to ask you a question.
Hi, doctor. My name is Michelle Thompson. I was at work and someone called me from the hospital, and they said my daughter is here. Her name is Sarah Thompson. Is she here? Can you tell me about her? She is 8 years old and was at my sister's house swimming.
So these conversations are had every day in ERs and in hospitals, and they're difficult, and no one practices them until the moment. So how do you get those young minds to say your daughter is brain dead? Or is that the right way of saying your daughter is brain dead? We don't know because we don't have the tools or the resources to educate those young minds. And this is going to be our next push for clinician training, is to practice conversations in a virtual world. I want to thank all of you for your time. I'm so sorry for running over. I'd be more than happy to talk to people afterwards and answer questions as well.
Our first assignment was to just use